I am Dr. Mohammed Musthafa. I am a chief cardiologist at this Metromed International Cardiac Center, Calicut. So it is a cardiology specialized center where we are doing everything for heart disease, right from angiogram up to heart transplantation is being done in our center. So as you know that today is heart disease is the #1 killer disease among human population across the world, and previously we used to say that this is a rich man's disease and this was more prevalent in the Western world. But you know, now the disease is increasing or rampant in the Asian countries including India, and that is how we are focusing on in our center. Actually we have a special focus for prevention of heart disease, and we have another area like to treat all the heart disease under this center. So currently the main reason for this increase in incidence of heart disease is because of the lifestyle diseases. I think you must have heard about lifestyle diseases. For example, in other words, we call it as risk factors for heart disease. So the #1, you can say diabetes is one of the risk factor. Then the other one is hypertension. In other words, we call it as high blood pressure. Then the third thing is like cholesterol, which is again another important risk factors. Then we have obesity, stress, lack of exercise, and then family history, that is the genetic predisposition. So these are the main reason for rapid increase in the incidence of heart disease across the globe. I think that may not be a very relevant question for the public. Right heart failure, could you please tell me like the causes for heart failure? Okay. See, now you know the heart disease is, as I told you, it is rampant and it is increasing day by day, and because of this and because of the availability of the treatment facilities like our center, many heart patients are surviving heart attack and many heart disease. So exactly what is happening is when somebody develops a heart attack and is survived by doing an angioplasty or bypass surgery, some of these patients survive with a damaged heart. It is not necessary that everyone will survive with a normal heart, because before the patient reaching the hospital, some damage must have happened to the heart. So such patients comes under the group of heart failure or heart dysfunction, LV dysfunction group. So what exactly happening is, see, every heart has a capacity to pump blood out of the heart to the entire body, but in these patients who already develop heart attack, their pumping function reduces. So gradually when this pumping function reduces, they develop heart failure. You know, heart is a pumping organ, it is like a motor. So when it fails the pumping function, then that will lead on to heart failure. So these are the patients, they will have more breathing difficulty and swelling all over the body and symptoms related to heart failure, similar symptoms related to heart failure.
Sir, could you please say what exactly cardiovascular diseases is and what are the risk factors?
Yeah, I think I already mentioned about that, the risk factors. See, now if you ask me about the heart disease, now the majority of the heart disease is because of the coronary artery disease. We can divide the heart disease into coronary heart disease and valvular heart disease and myocardial disease and congenital heart disease also. But now the majority, like in my practice, I see almost 75 to 80% of the patients are because of the coronary artery disease. That means the heart attack related or block related heart disease is called coronary heart disease.
As we have richly qualified doctors and technology in our country, in your opinion, why patients are choosing European and American countries for having heart treatment? Okay. I think see, India has really advanced, far advanced actually you can say, in the healthcare system. In the entire healthcare system, and of course I can say that even in cardiovascular disease management.
So being a cardiologist, and we have a center here in Calicut, which is an exclusive heart center, in which we are doing almost everything for heart. So I can confidently say that now if any treatment is available in any part of the world, which is available here in our center also, and with equal or even with better result outcome, you can say. See, this our center, Metromed International Cardiac Center, we started almost 5 years back. Since then we have performed more than 15,000 interventional cardiac procedures and more than 5,000 open heart surgeries, and I am very glad to say that we have a success rate of more than 99%. To be more precise, it was last year it was 99.6%. So this success rate is comparable with any part of the world or any other center anywhere in the world. And another interesting thing here is like when we are delivering such a high successful result with a very nominal charge actually. If you compare the cost of cardiology heart treatment or cardiac surgical treatment or interventional treatment for that matter, it is only, you can say that only 20% of the cost which is happening in the US, or maybe 25% when compared to Europe, or just 40% when compared to the Middle East or other part of the world. So yeah, Singapore or any other part of the world. But if you see that, I can say that India, and even more precisely saying that Kerala may be the most economical place for heart treatment. It is not a cheap place, you should remember. We are delivering a highest standard quality, which I have already told you, with a success rate more than 99% for a very nominal tariff. So I think Kerala is already there in the tourism map. So Kerala is going to be there in the tourism map, of health tourism map again, because of these combinations of delivering a very good care which is better than any other place and for a very nominal reasonable tariff.
Angioplasties charge Europe, US and in Kerala.
I think the tariff or the charge for angioplasty or angiogram, you cannot compare it with any of the European countries or US, because it is much lower actually. So in Kerala actually it is something like 1.5 to 2 lakhs for a single block angioplasties, which is definitely about 20 lakhs or more in the US, or 10 lakhs or more in the Europe. So our charge is very nominal, and we are using the same materials or the stents which they are using in the US and in the Europe.